The Florida Department of Health understands that some of you may be concerned about your pets. The CDC has not received any reports of pets or other animals contracting COVID-19. However, it is always a good precaution to wash your hands after touching an animal. People with COVID-19 are asked to limit interaction with pets and other animals. Specifically, while they are symptomatic, they should maintain separation from pets as they would with any household members and avoid direct contact with pets, including petting, snuggling, being kissed or licked, and sharing food. The length of time that COVID-19 survives depends on factors. These factors include the type of material or body fluid containing the virus and various environmental conditions such as temperature or humidity. Researchers at the CDC and other institutions are designing standardized experiments to measure how long COVID-19 can survive in situations that simulate natural environmental conditions. So until more is known, clean often, especially high-touch surfaces.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/stay safe for up-to-date information and tips.
The Florida Department of Health has teamed up with Hillsborough County government and other public health and safety agencies to address any impacts coronavirus may have on our local community. Not everything is known about the coronavirus yet, but the Center for Disease Control and Prevention, CDC, has narrowed down key symptoms of the virus: fever, cough, and shortness of breath. The CDC says these symptoms may even appear 2 to 14 days after exposure to the virus. If you experience these symptoms, you're urged to stay home and call your doctor. It's important to know the difference between symptoms of the coronavirus and other illnesses. The CDC says people who have the flu will often feel some or all of these symptoms: fever or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, allergies. The common symptoms of seasonal allergies include sneezing and an itchy, runny, or congested nose, itchy, red, watering eyes, wheezing, chest tightness, shortness of breath, cough, raised, itchy, red rash, swollen lips, tongue, eyes, or face, dry, red, and cracked skin. You should call your doctor if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread
afternoon, everyone. I'm going to call the Emergency Policy Group meeting to order. Would the clerk please call the roll?
Good afternoon, Miller.
Here.
Overman.
Here.
Murman.
Here.
Cronister.
Emma Lazinski for Sheriff Cronister. He'll be joining us in a few minutes.
Very good. Caster.
Here.
Ross.
Ross is here.
Here. Lott. Here. Snively.
Here.
Thank you. You have a quorum.
Thank you. Clerk, when you call in the roll, please add Mr. Merrill's name on there so we'll know he's on the phone. When you call the roll, just add his name to the roll call if you don't mind.
Yes, sir.
Secondly,
I am.
Okay, thanks, Mike. Secondly, remember, ladies and gentlemen, to put your phones on mute until you're ready to speak, because we don't want to get any feedback. If you're watching it through iPad or something along those lines, please turn the volume down on that. And again, good afternoon. I hope everyone had a pleasant weekend. I know it's been pretty busy for us over the weekend, but again, welcome back to the EPG meeting. We have a very long agenda today, very intense, long agenda. So what I want to ask you all is, if you have a question on each subject area, ask it only one time, and please do not give a dissertation before you ask your question. Just go directly to the question so it can be asked. We can move on down the agenda because we have a very long agenda. We want to be here all afternoon. So on each subject area, if you have a question, ask that one question and ask it as a question and not a dissertation before the question. That's agreed upon everyone. We're going to move on. I'm going to call on Dr. Holt to give a Department of Health update.
Yes, sir. Good afternoon. I'm Dr. Doug Holt from the Florida Department of Health. Actually, I'd like to begin by just recognizing that it's Doctors' Day, and I think all of our healthcare workers in the EMS need a lot of recognition right now. Last week, the focus was appropriately on the degree of social distancing and just driving around over the last weekend. I think many got the message. Today, I want to focus on really a plan to care for a surge of ill persons that, depending on the outcome or what's ahead of us, we need to be prepared to deal with. The elements are to ensure that our patients get appropriate medical care in the best place and those where they're safe, also for the others around them. I shared an outline of this concept. It's a table that I want to emphasize. It's a concept that's being developed actively in collaboration with our medical community. And each of them today will sort of share with you kind of where they are. I also would like, I guess, to begin just to address one question that I think has come up, which was about our cosmetologists, barbershops, and other nail salon centers, about conditions that they would be able to remain open. And our recommendations are that as long as their employees and the patrons coming in are well, they should not be ill, that they maintain 6 feet distance, except when they're in direct contact with servicing, that all the patrons should be separated. It shouldn't be more than 10 in the facility or in the room. And then the individual employee should be hand washing in between. Mask and gloves would also be appropriate. I'll then talk about...
Dr. Holt.
Yes.
Just hold on. Are you recommending that we change the safer at home order to add stylists, barbers, and nail technicians to the order if they meet the needs, the criteria, what you just read off?
I don't believe so. I do not believe so. I apologize. I was asked this by the team in response to one of the members. wanted some clarifications. I apologize if I am changing the order. I do not mean so. I believe, so I perhaps shouldn't have answered that question, but I knew it had been come up, but I was, so
Well, finish your presentation. I think that's an issue we'll have to come back to.
Yeah, I apologize for bringing that up then. Our number of cases as of March 30th are 238. We've had 2 deaths, and over this time, about 40 have been hospitalized. 27 of the 238 have been over 60. Our 15 have been healthcare workers. We've had a first responder. As far as the related, where the identification of their risk, 36 have been travel related, and 55 of them were contacts of another close case. We continue to be focused on our triaging, those people who need or cases that need urgent action, particularly if they have connection with a congregation or healthcare workers or individuals at high risk for severe disease. With that, I was going to now transition to a quick presentation by Dr. Sinnott. Would you prefer all the questions be held at the end for my presentation as a group, or do you want questions now, sir? I apologize for asking.
Well, let's go back to your first presentation, part of your presentation, when I think you said that it would be recommended that have barbers, stylists, nail technicians, massage folks could do their job, but you gave some stipulations of how they could do it. Am I reading you right?
Correct. These are pretty much standard recommendations for other types of, and I guess I did not take into account if they were listed under the essential category. I apologize. These are more general for any business or anybody who's having customer contact with them that's required.
And the reason I'm bringing this up, Dr. Holt, is because I know I've gotten many, many emails and phone calls from people all in those industries wanting to know how we can work with them to keep their businesses open because they're not in the essential category. So that's why I'm asking you a straight up question. If a barber or a stylist or a nail technician or a massage person or any of those people that work closely with clients, are you recommending now that if they do certain, meet certain criteria and perform certain, whatever you put in place, that they can now have their businesses open? That's my question.
I was asked a specific question that said, what would it take, or what would be the conditions under which these facilities should be opened? That's my response. As far as, I guess, whether they fit in the broad category, I would leave that up to the group to decide if they are appropriate for that. But these are the conditions that would be necessary if they're allowed.
Mr. Merrill, within our order as it presently is, those particular type of jobs or personnel are not in our essential category. Am I correct?
Correct. That's correct.
So
currently in the order, and certainly Christine can, or her team can jump in, but currently there is a specifically in the order, and certainly Christine can, or her team can jump in, but currently there is a specifically in the order, and certainly Christine can, or her team can jump in, but currently there is a specifically in the order, and certainly Christine can, or her team can jump in, but currently.
What's going on here?
I can't stop it. I don't know. It just keeps playing over and over again.
Okay, go ahead, Mr. Merrill. I think we got it corrected.
All right. Okay. So in the order, there's a specific provision that says under the allowed businesses that if you're a non-essential business, you still have to maintain the 6-foot distancing and all the other protocols. It also specifies that, you know, certain businesses by definition, such as hairstylists or nail salons, cannot maintain 6-foot distancing. I mean, and that's just common sense. I mean, so, you know, in order for someone who is working on someone's hair to protect themselves and a client, they would need to have all of the proper protective gear. And so, for example, you know, when we operate our collection centers at Raymond James Stadium, or a hospital collects a sample, and they don't know whether the person they're testing is infected or not, they are fully wardrobed in specified protective gear, special masks, special eye protection, special gowns. So by extension, if you have a special mask, what is wrong with this thing?
Okay.
Do you hear that constant repeat?
Yes. I don't know if it's a system or someone has a phone on not on mute. I hope it's just a system backfiring on us. But go ahead and try it again.
So by definition, you know, someone who is working on someone's hair and standing and touching that person doesn't know whether that person is infected. You know, unless they can protect themselves with the proper equipment, that was the reason behind providing for that specifically in the order. And so I think, I speak for Dr. Holt, but this question did come up, and he was asked to respond to it. I mean, unless someone can protect themselves and their client to the same extent, then both the worker and the customer are taking a huge risk. Otherwise, we would be allowing the nurses at the collection site to wear shorts and a t-shirt. So, I mean, you know, I get the fact that the problem is that these businesses are being affected, but, you know, on the other hand, it is common sense, and it's stating the obvious. And so I think that's what Dr. Holt was saying, and obviously it's up to the policy group, but.
And Commissioner, I would clarify and echo that. I mean, those are pretty extreme, unrealistic situations that I described for a business to really comply with in that setting. And so it's very reasonable and sensible why that group would have been included in the initial order. I'll stop there.
Yeah, Mr. Dr. Holt, I appreciate you bringing that up, and I didn't mean to kind of put you in the corner there, but there has been a lot of phone calls, emails about those type of businesses and how they can do certain things that could keep the businesses open. And my thing is, like Mr. Merrill just said, those people that are giving the test or working in hospitals with the personal protective equipment they have on, I would suspect that if you're going to do that as a barbershop or a stylist or a nail salon, you'd have to have that same equipment. So that's out the picture. Okay, Dr. Holt, thank you for that. You're going to bring up someone else you mentioned a few minutes ago?
If that's yes, sir. Thank you. I'd like to ask Dr. John Sinnott. He's a professor at USF Morsani College of Medicine. He's also a special advisor to the Global Viral Network to really talk about, just remind us about COVID illnesses over a spectrum of cases where from well to sick, and also some of the testing options that we currently have and may be to come. Dr. Sinnott?
For the public record, distinguished elected officials, colleagues, and guests, first I want to express our deepest sympathy to patients and anyone affected by this terrible disease. I also want to thank Commissioner Murman, when she was representative, She started the Florida Infectious Disease Institute, which is leading the way for a lot of the initiatives we described. Thank you, Commissioner Murman. First, a little background. COVID-19 is the name of a disease. The virus is SARS-CoV-2, probably the most awkward name they could have come up with. It's a new respiratory disease caused by a new virus. It started December 10th in Wuhan, China. It was capable of amazingly quick spread. And I can give an example of Italy. For the first week in February, they had 3 cases. By the third week in February, they had 15,000 cases. That's how quickly it can spread. The symptoms are cough, fever, diarrhea, and usually loss of smell. It's transmitted by droplets, by cough, and by the fecal oral route. I want to take a moment and go over what happens to 100 people that get tested. Okay? 18 of this 100 will not recall being ill and will not become ill. One clear reason, whether it's strong immunity, these people don't get sick, but they can on occasion spread the virus. About 80 of the 100 will get sick. Of those 80, 18 will end up in the hospital, usually because of underlying disease, heart disease, lung disease, diabetes, immunosuppression. Of those 18 in the hospital, 2 will end up in the intensive care unit. We're trying to manage as many patients as we can at home. Number one, patients are more comfortable at home. Number two, it doesn't deplete our precious supplies of personal protective equipment, and also contributes to social distancing, which, by the way, the Commission deserves kudos for enacting that last week. I know that took a great deal of bravery. So far, globally, it's the only thing we know that works. Hillsborough has about 5,473 cases. Remember, that'll be different tomorrow. We've done 55,000 PCR assays, of which roughly 2% are positive. This epidemic, Tampa Bay, will probably not follow the course of Miami and Broward, which are more vertical cities, with condos full of people, etc. We're much more spread out, so I suspect it's going to be hopefully nothing, but hopefully more of a rolling epidemic and not everyone at once. We have a number of treatment trials that we're starting up for the therapy of COVID-19. Recall, there is no accepted therapy, there's no vaccine, and there will not be a vaccine for 1 year to 18 months. Why I'm really here, or not really, but a point I want to make, and I want to make it for today, because this probably will only last a couple of weeks. There are 2 ways, assays, to look at this virus. One is a polymerase chain reaction, abbreviated PCR, which looks at virus RNA. The other one, which was, I'm not sure who deserves credit, but somebody was really smart to get the antibody assay. That gives totally different information and very valuable. A PCR assay is a snapshot. It just tells you that at 1:30 this afternoon, you don't have the virus. You could be infected later in the day, later in the week, later in the month. It's not predictive except for illness, okay? It's most appropriate for patients and not what many people would refer to as the worried well. For the moment, and I stress for the moment, there's a shortage. It's a scarce resource. Why? There's a shortage of reagents, a shortage of molecular biologists, a shortage of machines, and multiple supply chain issues ranging from swabs to the right book to move the swabs in to up-to-date testing equipment. In discussion with colleagues around the country and looking at the CDC guidelines, I think prudence would dictate that PCR be used for essential personnel that don't feel well. Who would be there? Our frontline people, the first responders, law enforcement, healthcare workers, nursing homes. The second assay is an antibody assay, and there are two parts to it, which would make two different antibodies. The IgM antibody is for acute illness. The IgG is for past. Remember, the G is gone. So if someone is positive for IgG, they have had the disease and they're immune. They don't need personal protective equipment. They're not going to get sick from infection again. If you have an IgM positive, you've sort of entered a gray area. IgM overlaps from illness to wellness by about a week or so. So this is not going to be common. But if we have a positive IgM, they need to be referred to their healthcare provider. If these tests are negative, IgG negative, or IgM positive, these are IgM negative, IgG negative, these patients are very susceptible to infection. They should stay home, self-isolate, and follow the CDC guidelines. So basically, prudence would use PCR for essential workers, first responders, nursing home, law enforcement, healthcare. The antibody assay would be used more for the worried well. People that are worried they have it, but can't really give a specific reason. From that, we will be able to find out how many people in the community have had it and didn't know it. And it will be about 18%. Those people will be immune. They don't need to worry about stuff, isolating or progressing to disease. And they could be an invaluable source of plasma to treat critically ill patients. In conclusion, I would like to thank you for this and segue into the next issue is these large group of patients that are not admitted to the hospital. They go home, but they need active management. You can't just wait for them to call in sick because they might not ever call in. So someone needs to call them each day, ask about their pulse, their temperature, how do they feel. Maybe they need social services. Maybe they need food delivered. You know, these all seem government functions to me. But I want to thank you very much to address such a distinguished commission that has made so many sound decisions. Thank you.
Thank you, sir. Doctor, we appreciate that very, very much. Are there any questions? Are there any questions?
Yes, gentlemen, this is Mayor Castor. I have a couple questions.
We said one, Mayor Castor. Go ahead.
Oh, okay. One question. Dr. Sinnott, I spoke with Dr. Lockwood for quite some time yesterday, and you know, he talked about the antibody testing, and really since we've sort of lost the actual testing window here without the supplies, he thought that that would be one of the areas that would best be focused on. So, you know, allowing individuals to take that antibody test, find out if they've had it and go back to work, or be able to care for those that are high risk. So is that antibody test ready? I thought he said it would be 2 to 3 weeks before we could test, but I may have heard incorrectly.
It was my understanding that a number of tests were being delivered either to the emergency response center or the fire department. And what you stated was exactly right. That is a perfect group to use it on.
Okay, thanks. Thank you, Chairman.
Welcome. Any other questions? Any other questions?
Chair,
Yes,
Mr. Chair, this is Mike Merrill.
Mr. Merrill,
This is Mike. Yes, so we had asked Dr. Holt to engage a specialist like Dr. Sinnott to address that test, and so that you know, we could be sure that the tests that we've ordered, or the tools, the kits that we've ordered, would in fact give us good results. And so I wanted the group to have the benefit of hearing, you know, what role that could play. And so I appreciate Dr. Holt and Dr. Sinnott for clearing that up.
Hey, Mike, this is Dr. Holt. Just a clarification, maybe I should ask, actually. We're talking about using this test in people that are well, or maybe have had infection and have recovered. Is that correct?
Yes, that's correct.
Are there any other questions? Dr.
This is Commissioner Overman. I have a question.
Commissioner Overman, question, please.
Thank you very much. Given that we've seen a doubling of our hospitalizations, and based on Dr. Simmett's report, it sounds as though there's a varying period of contagiousness. And we are seeing an increase in hospitalizations. We're starting to realize what our exposure is. If we find that there are a significant number of infections in the area, how do we go about making sure our hospitals have what they need? For example, and this is probably more for Dr. Holt, in coordination with our hospital services and our hospital resources, it sounds as though one of the treatments that I've heard is ventilators. I mean, ventilators. You know, clearly we've got a shortage of other supplies for being able to test. But at the end of the day, when we see the doubleization of hospitalizations, are we taking an inventory of ventilators in the event that our hospitalization numbers accelerate? And, you know, but given that we don't really know when the incubation period for cross-contamination or community spread is identified. I mean, unless Dr. Simmett can answer that question, when prior to showing symptoms does the contamination period exist? And do we have ventilators to be able to care for a high increase or a continual doubling of hospitalization?
This is Dr. Holt. I can answer the first about the current status, which actually Dr. Sita Lakshmi was going to give us a sense of what Tampa General is currently in and their situation, which I think is comparable or similar to other institutions that our data that is tracked by the EOC regarding the number of hospital beds, ICUs that are available, number of ventilators that are available, and things like that. And this is to understand what you're asking, I think, is what and when is what's on the horizon and when it will get here. The majority of the hospitalized patients so far that we've had, or at least half of them, are no longer hospitalized. So we're able to manage them in an outpatient setting, fortunately. But over time, that's clearly going to be a challenge, and it's going to where our care coordination plan has to be robust. Right now, Tampa General is, and this is, I think, again, similar, anyone who drives up to their emergency room or presents is triaged, if you will, to assure if they need medical urgent care, they go right in, but if not, and they're ill, they go to an alternate location where they are evaluated. And if they are admitted with an illness that looks like COVID-19, they have designated specific areas in their hospital that can be managed for those while their testing comes back. Of those that are positive, they are in the ICU, managing them within one unit and have plans if needed to expand. Currently, they have no ventilator shortage, and I think the total number of ICU beds combined in the county was about 35% of the current capacity. All of that said, it's critical that we do prepare for those, and therefore my understanding is, and EOC and others can speak for this, is that we have placed an order to get locally to get into Hillsborough County 70 ventilators with 500 on order. I'll stop there.
Are there any other questions? Dr. Holt, Dr. Sinnott, thank you very much. We appreciate you being here and giving us the valuable information. Thank you so very much.
Okay, that brings me. Oh, sorry.
I didn't mean to cut you off, Dr. Holt. I'm sorry. Go ahead.
That does bring me to what the care coordination management plan that is, again, I will emphasize, is being developed. It won't take the exact. Every system may have a different one, but right now we are already preparing for the cases we have and the cases to come. We have representatives of each of the hospitals. I'd like to begin with asking Dr. Asa Oxner to talk about the USF Tampa General Plan. Dr. Oxner?
Hi, this is Dr. Asa Oxner. I'm one of the general internal medicine doctors at USF and Tampa General. Thank you guys for letting me talk to you. I have met most of you in person before for the syringe exchange program discussion. So I know what you guys all look like. I'm imagining it. So just in a little bit of an overview here of what we're setting up at Tampa General and USF to follow up patients who are confirmed of having coronavirus. We are doing a telephone call with them on the first day after they leave the hospital, or if they are outpatients, then we're doing a phone call with them on the first day that they get the positive results. And that phone call asks a few questions that helps us risk stratify them between being a high risk for complication as their disease progresses versus a low risk. We're giving them some patient information, and then depending on where their risk stratifies, we're setting them up with a video visit with a physician, myself or one of their internal medicine physicians, on a schedule in every 3 days or sometimes more often if they're very high risk. And so we're really doing we're trying to keep people at home, but trying to do it in a very well-monitored way based on evidence that we're learning from Germany and Italy and some of our colleagues in the New England area as well, so that we can reduce the number of infections that are occurring to healthcare workers in the hospital, but not compromise patient care.
Thank you, Dr. Oxner. Is anyone there from Adventist Health to provide just sort of a where you are in your plans? Yes, hello. This is Dr. Doug Ardwin. I'm the president of the Advent Health Physician Network here in West Florida for our division, and I certainly appreciate and thank you for allowing me to join the call and describe the process that we have in place today. So I'm going to go ahead and do that now. We are capable of tracking all patients through a software that we use that acts like a control center. It has a real-time dashboard that shows each of our facilities and all of the identified patients. We get regular reports out to our care management team so that they can see the patients who are either COVID-19 positive or who are waiting for the results of their test. That information includes all the patient demographics, address, phone number, et cetera, so that we can follow them outside of the hospital or the emergency department. Our team here then follows up with every patient who either is discharged from the hospital or comes into our emergency department. We follow them to make sure they have follow-up office visits, and we assist with that, setting that follow-up appointment, checking to make sure they have the proper nutrition, all their medications, and transportation to their, if they need transportation, we can help arrange that. And certainly we are working through virtual and televisits primarily now as well for follow-up. And we have a way to address behavioral and mental health issues as well. Our nurses will contact all patients. If we deem them to be high risk, we contact them within 24 hours. If we deem them to be at lower risk, within 48 hours. And we will remain in contact with each patient for 30 days to help monitor symptoms. And from that, that allows us to ensure that the patient is following their care plan from the physician. And it also allows our nurse care manager to escalate any concerns or worsening symptoms to the patient's physician. So this is the process we have in place today, and that we plan to continue to follow unless something were to change or we were to come upon a better practice. Thank you, sir. Is BayCare? Would you update?
Yes, sir. Thank you very much. This is Kristen Grifer. I'm the Chief Medical Officer for the BayCare Physician Partners in Value-Based Care. And we have a similar setup. We have a dashboard that my care managers can see that has every patient in the hospital or the ER who has had a COVID test done, whether it's positive or negative. If they get discharged from the hospital or from the ER, then my care management team reaches out on the next day, does a risk stratification, and tiers people into needing to be called every day versus every 3 days. Also looking for patients who might need home health and referring over to home health and remote patient monitoring, for example. We are facilitating video visits with physicians, in addition to having face-to-face visits if necessary in our clinics that can see COVID patients. And we have a team of social workers who are also working with these patients with respect to the other things that come up when they get discharged. We will be developing more plans and more coordination with our home health team over the next few days.
Thank you. And our HCA partners?
Yes, this is Steve Murta, CMO at Memorial Hospital, stepping in for Dr. Larry Feynman, the division CMO. I'd like to thank everyone on the call for allowing me to participate. I've been following from a higher level. We at HCA are, in fact, also seem to be very similarly engaged as our colleagues at Advent Health and BayCare. We have a dashboard that is monitored by our Care Assure team. Our Care Assure team mainly provides care to our CV patients and follows them for congestive heart failure and other findings. We've resourced and redirected them. We do feel we have the bandwidth with those navigators to monitor all inpatient positives and outpatient testing that's not back yet. They identify those individuals, call them. They have scripting to help the positives and the negatives so they understand the consequences or the concerns that they might have. We feel that we then provide whatever services they might request, helping them get to the resources that will help them. And for those patients that do not have primary care follow-up, we then direct them to our primary care network And for those that do, we encourage them to seek care with their primary care providers and answer any questions. We continue to look at our coordination and add resources to it as we feel need. Right now, our primary focus is on testing and getting testing done in a more expeditious manner so that we can relieve some of the anxiety from these patients. Again, thank you for the opportunity, and I'll continue to listen and provide feedback as necessary.
I want to thank the group. I know I was reassured that and not surprised again that we have such healthcare leadership in our community. With this as our foundation, I think we can continue to work to meet the needs, and there still are those that perhaps are not part of the systems now that will be also trying to include in some manner. Commissioners, we'll stop there. Be welcome to any questions.
Are there any questions, Dr. Holt, or the other doctors that are on the phone?
I have a question. It's Commissioner Murman.
Mr. Murman, you recognize?
There was a question about the closing of pools. I've gotten several emails about this. Public pools, community association pools. What is your recommendation on closing our pools in Hillsborough County?
I'll take that question. I guess it's Dr. Holt. I mean, we all have opinions. I certainly feel that they're sort of in that same category that we talked about a little bit, is that schools trying to maintain the spacing requirements that are recommended, and again, somewhat degree of enforcement and the potential for some pretty bad examples, let's say. I know that in the boating world, they've worked on that area. So I support right now at this time those type of restrictions personally, my opinion.
Okay, thank you.
Are there any other questions? Any other questions? Dr. Holt, your team, thank you very much. We appreciate you being here and giving us all the information that you provide us. We appreciate it very, very much. Thank you.
Finally, I'll just close with our long-term update. As you mentioned, this has been, I think, our focus very important. The state has contracted. We're going to have all of our facilities inspected by the American Medical Response, essentially looking at their compliance with standard practices and how they're doing. And we have our own strike rapid response team that, in the case that I do get a positive case, we will move in to quickly assess the needs of the individual, the acuity of the residents, any needs of the staff or the facility, risk of outbreak, and prepare for a potential outbreak. I'll stop there.
Dr. Holt, this is Commissioner Miller. I just had something pop on my phone. You probably can't comment on it, either of your team, because it just came out. It comes from the Institute for Health Metrics and Evaluation and Independent Population Health Research Center at the University of Washington. And they're saying that Florida's outbreak will be worst around May 3rd. Are you familiar with that, or you haven't heard anything about that yet?
Yeah, these are all based on modeling. These are mathematical formulas that there's many out there, and to me, it doesn't really matter. I'll deal with it until we're over it. I hope it comes sooner than later, but there is no, it is a forecast. It's a prognostication. Many of them do have some reasonable validity, and I'm sure the scientists can tell us exactly how those mathematical models that are developed, they're essentially based on what the Wall Street traders do to figure out, when to sell and buy. So, in all honesty, there's many of those out there, and they all have some varying degree of dates. That's my opinion.
Okay. All right. Thank you, sir. All right, thank you very much to your team. Appreciate it very much. We're going to move now to Mr. Tim Dudley for a emergency management update. Mr. Dudley.
Good afternoon. I'll provide a quick update of current EOC actions. We continue to coordinate countywide logistics support and manage personal protective equipment requests from healthcare communities. We have collected and submitted 897 resource requests to the Florida Department of Emergency Management. Our county staging area continues to receive and schedule deliveries of critical supplies. We are currently supporting operations at the Emergency Operations Center, the county staging area, donation warehouse, and isolation quarantine sites, as well as collection sites. We've received over 3,000 face shields, over 74,000 gloves, over 40,000 surgical masks, over 14,000 N95 masks, over 3,000 gowns, over 1,000 goggles. The donation management site at 250 West Shore Plaza continues to receive medical supplies and personal protective equipment donations from the community, with operations from 9 a.m. to 3 p.m. Monday through Friday with no end date. We will continue to operate that site for the duration. Collection sites will open again on Wednesday, 1 April, 8 a.m. We have 1,541 collection kits on hand. Call center to open tomorrow to resume screening 8 to 5. As you heard from the medical community, we require quite a bit of logistical support. One of our objectives was to take a look at quarantine and isolation facility operations plan. In accordance with guidance and DOH's guidance, we have completed and developed an operational plan for those sites. Facilities will increase DOH capacity to over 300 single occupancy rooms to support quarantine and isolation operations. DOH will manage screening, reservations for guests using telemedicine option and a direct call to DOH. Individuals with transportation challenges, their needs will be assessed during the DOH evaluation, and the appropriate agency will be contacted. Our next course of action will be looking at alternate care sites. Alternate care sites function as a step-down medical unit that provides basic supportive care. Alternate care sites are activated to relieve hospital surge. Basic supplies such as cots or baseline medical and administrative supplies are pulled from our existing special needs shelter package. Additional medical supplies used for treatment of individuals have been identified, and a request to the state will be made. The Yingling Center is identified as an alternate care site and would be established for up to 250 beds. This concludes my update.
Thank you, Mr. Dudley. Are there any questions, Mr. Dudley? Any questions?
I have a question. This is Commissioner Overman.
Commissioner Overman, you recognize.
First of all, I would love to say thank you very much, Mr. Dudley. You have done a wonderful job. I did receive the quarantine and isolation plan and went through it very carefully. It does address the various different levels of support, which is terrific. Two questions that are related to each other. Call center is only open when we have testing supplies available is part of that question. And the other is, if someone can't stay at home and they're a single parent, does the child go with them to, say, the isolation home? And if that patient ultimately ends up in the hospital, are you coordinating with the rest of the team members for care for that child or children in this particular case?
On the first question for the call center, yes, we have the call center running to make reservations according to the supplies that we have on hand. If we do not have the supplies on hand or the site's not open, we do not have that call center up and running.
So they go to the hospital, or they contact a hospital in the event that we don't have the capacity for testing at our center, or are they referred? I mean, does the Department of Health hang on to those individuals so if the window opens back up, they're the first in line? How does that work?
Currently, the way
we don't have a queue, obviously, if we run out of testing equipment. I'm sorry.
So we set our goal for each day, and each day there's a scheduled reservation, and we keep track of those reservations, and then we set another goal for each day, and then we continue to monitor those reservations. We have had some no-shows, and for those who no-showed for that site, we will reschedule and continue to put those availability of those kits back in the rotation, and we'll take the next person up.
Okay. All right. Any other questions? Any other questions? Thank you, Mr. Dudley. We're now moving to federal and state legislative update. Mr. Brandon Wagner.
Good afternoon, Mr. Chairman and members. My name is Brandon Wagner, Chief Administrator for Government Relations and Strategic Services. I'm here to offer a short summary of recent federal and state government actions in response to the virus. Since my last report to you on March 19th, Phase 3 legislation known as the CARES Act was swiftly passed and approved by the President on Friday, March 27th. This is a $2 trillion relief package for individuals, businesses, state and local governments, and healthcare. From that legislation, I've been asked to highlight two areas in particular. First is how much and when direct payments to individuals will be distributed by the federal government. Essentially, for anyone earning less than $75,000 in salary, direct payments will be $1,200 per person, $2,400 for joint taxpayers, and in addition, $500 each for every dependent child in a household. Those amounts begin to decrease once you achieve $75,000 or more for single individuals, $112,500 for heads of household, and $150,000 for joint taxpayers. Individuals earning $99,000 or more in salary, or joint filers earning $198,000 or more, will not be eligible for any direct payments. As to the when, those who have a direct deposit account with the IRS should begin to have their funds directly deposited by mid-April. Others will have a check mailed to the address on their most recent tax return year. The other question I was asked to speak to was what types, how much, and when will funds flow from the federal government through to our community. At this point, a lot of the details on the exact amount of funds that will come down are still being determined. Most of them are formulaic grants and funds, and in many cases, those formulas are being determined. These bills moved at such a rapid pace, decisions were made on the fly that now agencies are having to go in and make the decisions and run the formulas to determine how much that's going to be. I'll touch on 50,000 foot level funds that went for various purposes, $380 billion for economic relief for small businesses, nonprofit, and veterans organizations, $45 billion to FEMA for disaster relief funds, $4.3 billion for CDC programs focused on public health preparedness and response, $100 billion for reimbursement to healthcare providers, $945 million to the National Institutes of Health, spread amongst several institutes related to COVID-19, $6.3 billion to the Administration for Children and Families, of which $3.5 billion is for child care assistance for low-income families, $5 billion to CDBG, $900 million for low-income home energy assistance programs, and $750 million for Head Start programs, $955 million for older American programs such as nutrition services like Meals on Wheels and home and community-based supportive services, $30.9 billion to Department of Education, and $25 billion to transit agencies. Going forward, the focus will temporarily shift, as I said before, to agencies to determine how they're going to put the formulas together and get the funds out on the streets. Talks are currently underway about a fourth stimulus package. House leadership has stated that they believe it is necessary. Early reports are that it could be infrastructure focused, including some surface transportation reauthorizations, water resources, and perhaps broadband. It's also expected that there'll be some push in the renewable energy area, tax credits for green energy. Could also be another push to buy oil for the Strategic Petroleum Reserve. It's anticipated that the local government associations, such as the National Association of Counties and U.S. Conference of Mayors, will seek more indirect funding to locals, as well as to fix the emergency leave tax issue that I had spoken about on March 19th. At the state level, at this point, the state is coordinating with the federal government. We anticipate that the revenue estimating conference that's operated by the state will convene sometime in June, if not afterwards, to review the current economic situation. And there's a potential for a special session sometime in the fall to address the state budget if necessary. Going forward, we continue to coordinate with the emergency management team to advocate for needed supplies and equipment. We encourage you all to do the same. We are happy to serve as a clearinghouse of information, if you will. Any assistance that we can lend to you or your teams, we are happy to do. And we will continue to keep you informed on state and federal activities. We've sent out some emails to the membership as things have occurred. We'll continue to do so. If you have any questions going forward, please let us know. We'll be happy to get those answered for you. And I'll be happy to answer any questions that I can now if necessary. Thank you.
Thank you, Mr. Wagner. Are there any questions of Mr. Wagner? Any questions of Mr. Wagner? Thank you very much. Introduction of subject matter updates. Mr. Merrill.
Thank you, Mr. Chair. Just a couple of quick items before we get into the subject matter reports. Included in your backup for the EPG was a memo from me indicating that I did sign 2 hotel leases on Saturday, and I signed the operations plan that Mr. Dudley talked about yesterday. There's 2 hotel sites, total of 360 rooms. That's effective immediately. They are 6-month term leases. They can be extended or terminated. I'm not going to give out the location today. We're still transitioning those over. However, Liana Lopez in her presentation will talk about a rollout of those sites. There's HIPAA concerns and other things we need to be sure of. But we will make the sites known, but we want to roll it out in a way that is respectful to the hotel owners, who have been very, very cooperative and really very good partners in working with us here. So that's where we stand on the hotels and the operation plan. I asked my management and budget and economist to just give me a quick look at where things are. Through March 30th, collections of property taxes have been on target, so it doesn't appear that there will be any impact on the FY20 budget in terms of ad valorem revenue. Basing it on the last recession, 2008, there probably will not be an adverse impact on the collection of taxes. However, the recession in 2008 did impact taxable values, which of course affects the total tax dollars that are collected. So any impacts on property taxes from COVID-19 are much more likely to impact FY21 and not this year. Sales and use taxes, including local discretionary sales surtaxes. We won't have an indication of February sales tax results until mid to late April. The indication of March sales tax results will likely be available in mid to late May. The state's chief economist, Amy Baker, was quoted recently saying it's too early to say just how far Florida's revenues will fall. Her office has been building new economic models based on the impacts of previous pandemics, and she indicated there's still too many unknown variables. My management and budget folks are working on revenue scenarios. The current starting point of these scenarios is the approximately 25% decline in sales tax and tourist tax revenue that occurred over the 3-year period during the 2008-2011 recession. So we want to look at using that as a baseline and then do some sensitivity analysis to see what possible levels of impact that will have in the FY21 budget. Unemployment, John Flanagan, CEO of CareerSource, indicated that they typically get about 160 calls on their line per day, and they're averaging around 500 calls a day right now. Of course, we are all working closely with CareerSource as the main agency to help place people. In Florida, initial jobless claims soared in the week ending March 19th. According to the U.S. Department of Labor, record 74,000 applications statewide. Previous record was set in 2009 of about 40,000 applications. So that just kind of gives you a snapshot of the financial side of this thing. So I've arranged for 5 brief presentations. Most of them are to answer questions that were raised by the EPG the prior meeting. Others information is just things that I felt was important for you to be aware of. So we'll do 5 of them. The first is Gene Earley talking about testing and collection for homebound individuals. Carl Harness, who is the Chief Human Services Administrator, will talk about the resources and actions to provide social service needs countywide. Third will be Bonnie Wise talking about what we're doing to meet jobless and small business needs. Fourth will be Ramin Kouzehkanani, my Chief Information Innovation Administrator, talking about county foster care needs for children. And finally, Liana Lopez, Chief Communications Administrator, talking about joint communications and public information efforts. I do have the related directors on the line and other executive staff in case you do have detailed questions. So with that, I'll begin with Gene Earley.
Good afternoon, members of the Emergency Policy Group. I'm Gene Earley with Hillsborough County. The county's been working with Tampa Family Health Centers, Ms. Sherry Hoback and Mr. Brad Harriman, CEOs of the Suncoast Community Health Centers and Tampa Family Health Centers, both of which are federally qualified health centers. And I'm pleased to report that they have agreed to partner with the Department of Health and the county to provide all patients at-home testing for those that are homebound who qualify for the Hillsborough County Healthcare Plan. We believe this solution will provide appropriate follow-up and physician patient management for those that have the test at home. As an overview, patients would call into the federally qualified health center and be screened as they are doing today with patients. If the patients answer yes to the screening criteria and is homebound, the FQHC would then coordinate a time, go to the patient's home, meet them outside to collect the swab. Like the other tests, sites, kits, and PPE are essential to their ongoing abilities to provide this limited service. The federally qualified health centers follow the DOH and EOEC process for requesting the kits and PPE. In all cases, like Raymond James test site, they would require screening to ensure the Department of Health criteria is met. In coordination with DOH and our partners, the county is continuing to develop other transportation processes at the EOC. The actual FQHC clinical patient flow is presently being developed with their medical director, and we had a joint meeting with federally qualified health centers to help develop the full clinical process flow and establishment of clinical protocols to manage the patients at home as appropriate. Ms. Sherry Hoback and Mr. Brad Harriman are also on the phone should you have any additional detailed questions or if they choose to make a comment.
Any questions? Any questions? Okay, thank you, Mr. Earley.
Yes, sir.
Mr. Harness.
Good afternoon, Mr. Chair, honorable members of the EPG. I wanted to give you a summary report of the response that we've had up to date as it relates to what we've been doing with our Homeless Services Department and our Social Services Department. Our Homeless Services Department has been working very closely with THHI, who's our lead agency here in coordinating responses to all things homeless here. And working very closely with the city and their resources as it relates to our response experiencing what we're experiencing here with COVID-19. As you may be aware, the three entities came together with a plan to provide interventional strategies to hopefully reduce the transmission of COVID-19 amongst our vulnerable populations of our homeless citizens out in the streets, and especially for those that are unsheltered. This strategy, there are two main strategies, and the first strategies have three element components to it. And the first one, most of you are familiar with the fact that the city, in partnership with Catholic Charities, has just opened up a temporary housing facility, which provides 100 tents for guests for the vulnerable, unsheltered populations to be sheltered in a safe and a safe environment for which we can care for them and hopefully reduce the amount of vulnerability that they would have experienced had they been on the streets. This facility also will accommodate 27 beds for persons that, if the case requires, if they require isolation or even quarantine, we have a facility. There's a facility on site that will accommodate that. There is a partnership with BayCare Health Services that should we have to provide services to those that are isolated and quarantined, BayCare will be providing those services. All of the guests that are residing at the facility will have access to case management and other supportive services, and this initiative is being closely supported by their efforts with THHI and by the county. The second element to this, should we need it, the county's prepared. We are prepared to enter into an agreement with Metropolitan Ministries to provide additional shelters specifically for families or single women within that vulnerable population that might have a need for temporary housing by providing an additional 50 motel rooms. This is in addition to the motel leases that Mr. Merrill spoke about earlier. And again, if we go to that option, any of our guests residing within those motels, any of those families or single women will have access to case management and other supportive services. And again, a third element to this temporary housing strategy, should it be needed, we're prepared to, where we have in the plan, we're prepared to provide some additional capacity by securing large commercial scale tents, which would have AC capabilities, and installing those tents at existing shelters, which would be able to allow us to create more capacity, obviously keeping the distancing requirements in mind. We also are prepared to secure 50 additional motel rooms in addition to the 50 I had talked about earlier with Metropolitan Ministries, and in addition to the ones that Mr. Merrill talked about earlier. So commercial tenting to provide additional capacity at existing shelters, and maybe an additional 50 motel rooms if required, is a third part of that plan. And as with the other options, any clients that we would have or any guests that we would have availing themselves of those options, they would have full access to case management and supportive services. Strategy 2 of the plan at this point, we will be coordinating with outreach teams. We will be utilizing community and faith-based groups to assist us with this in addition to our own outreach teams. And we will be reaching out to unsheltered citizens that wish to or desire to shelter in place out within the community, to provide them with access to health care, food, water, hygiene, and other personal care needs. Again, should they desire to shelter in place out in the community. And we will also be providing any other additional case management and supportive services, keeping in mind the distancing requirements we're abiding by for all of our other services. PHHI has been continuously providing us with information as they get it from the federal and state and other local entities. All of the options that I had mentioned above, we have gotten guidance from the Department of Health as well as some of our state and federal partners in terms of the methodologies that we're wanting to embark on in terms of utilizing some of these options. With the homeless, I will stop there in case there are any questions. I believe we do have Antoinette Triplett and Felicia Crosby-Rucker on the line if you have any questions that they might be able to avail themselves of also.
Thank you, Mr. Harness. Any questions, Mr. Harness? Any questions of Mr. Harness? Okay, Mr. Harness, is there anything else you need to bring for, sir?
Oh, yes, sir. That was part one. Part two, as it relates to what we've been doing with our social services department, service continues. Eligibility appointments, we've been continuing with those on a virtual basis. We've relaxed many of our criteria there. We're utilizing a telephonic interviewing process. We've waived a lot of the application signature requirements on the grant forms. And due to the fact that we've kind of abbreviated our eligibility process, we have been able to schedule additional appointments. So we've been adding and increasing availability to access to those crisis interventional services. Families that are already, individuals and families that are already enrolled in our self-sufficiency case management programs, they continue to receive those services electronically or telephonically, which includes crisis interventional services. We have not had any interruption in service in processing our incoming college scholarship applications. We have extended the deadline, however, and that has been communicated to all families that are interested in that service. Signage has been posted on all of our doorways of our community resource centers in case there are still folks that are in case we're still getting walk-up traffic. And we have provided information on how people can still contact us. They can still call any of our resource centers. The main numbers are all still in operation. When the callers call, basically, if they press 2, the call will be routed to our call center, and they will be appropriately referred to the proper services. The department is maintaining ongoing communication and collaboration with our utility providers for the continued suspension of account disconnects for non-payment. This will continue throughout the duration of this crisis. We continue to communicate with our utility providers as it relates to us referring clients due to delinquent accounts, so that we can make sure that they're immediately referred for assistance and they can get assistance with their disconnects and during the suspension period. We are also in communications with our utility departments in terms of them hopefully giving us advance notice and notification when the disconnect orders will resume, so that we can prepare to be able to address the spike in the crisis intervention service request as that service comes back online. Let's see. Households that are impacted by the crisis and loss of wage will be included in the vulnerable population definition, prioritized to access these services, and we are allowing assistance for the 1 year rule. 1 year rule for a household being able to be assisted during a 12-month period. We're excluding that 1 year rule period, so households can be assisted right now during this time period during multiple times throughout the year as we deal with this crisis. And at this point, because it's kind of closely related to some of the things that the social services department is dealing with, If he's on the line, I would like to ask George Cassady, who's the Assistant County Administrator for Public Utilities, to kind of give us a quick summary update on some of the things that the county is doing right now to assist the citizens with our utility services within the county.
Thank you, Carl, and good afternoon, Mr. Chair and members of the Emergency Planning Group. George Cassady, Public Utilities Administrator. And so I'd like to just give you a quick summary of what our normal process, our normal billing process and collection process is. We've got approximately 200,000 customer accounts in our service area, within our service area. And those accounts are primarily residential in nature. We bill on a monthly basis, so everybody receives a bill, one bill per month. And if you spread that out over the course of a month, we're sending out about 8,000 to 9,000 bills daily. So it gets a little complicated when you start looking at the number of bills that are out and how many of those are aged. Our typical process is once a bill is sent out, the bill is due 15 days later after receipt. Bills that are older than 30 days past due, we start initiating a little bit higher level of collection process. We'll send out notices to the customer. We'll try to make contact with the customer by phone and generally work out arrangements for payment. Over the last several years, we've really tried to work closely with our customer base and work payment plans where we can, trying to avoid disconnect if at all possible. And certainly in the normal process, once you go past a 30-day delinquency, then late fees apply. If you are disconnected, then there's a fee for reactivating the account. That's significantly changed in the last couple of weeks. Right now, for the last 2 weeks, we have suspended any disconnect due to lack of payment. We're also waiving late fees. Those are not being applied, and in conversations with social services, we're in agreement. There's no reason to pile on or make a difficult financial situation worse by applying late fees. Any advanced collection processes where we would ultimately turn these over to a collection agency, those have been suspended. We're not engaging in that. In fact, what we're trying to do is our customer service reps, once we start 30 days past notice, we're reaching out to our customers and encouraging them to call us and contact us so that we can understand their situation, see what we can do to work out a payment plan, or maybe even trying to find some agency that could help them through their financial hardship. We are working closely with social services, and we've been in touch with one another to see what we can do to lean on one another to help our residents and help our customers as much as possible. And with that, I'll be happy to answer any questions you might have.
Any questions?
Hi, it's Commissioner Murman. Can I ask, I need to ask George a question. Thank you, Mr. Chair. George, there's a lot of confusion out there with customers because they're getting those notices in the mail about potential increases or increases in their water rates. So are you just handling those on an individual basis? Or are you going to issue a new postcard, or how do you plan to do that?
So the notice, yes, ma'am. So the notices that were sent out were relating to the public hearing that we had scheduled, and that's going to be, because we're not having a board meeting this Wednesday, we're going to start the process over again. And yes, we're handling any calls and any questions on a case-by-case basis.
Okay, so we just send those on to you.
Yes, ma'am.
Thank you.
Any other questions? Okay, Mr. Harness.
Mr. Chair, just real quickly, so I can finish up here. Also, social services have been closely monitoring communications with various other governmental entities and partners. Obviously, the Hillsborough County Sheriff's Office suspending the resident evictions was of great help, I think, to our community to relieve folks of a lot of angst, having to worry about that. We've been in constant communication with Career Source. for reemployment assistance and applications for unemployment compensation benefits. We've been making referrals as needed to the Department of Children and Family Services for food stamps and SNAP benefits, and to help assist with requirements for eligibility, which are currently being relaxed and some of them temporarily eliminated. And also we've been serving as an education and advocate in an advocate role as it relates to educating our public on benefits for applying for the Family First Coronavirus Response Act, which provides for security paid leave, unemployment compensation funding, and free tested for COVID-19. Also, social services has been very active in working with Tim Dudley and his group in terms of assisting in helping to organize ongoing feeding task force, which is working internally and externally with various stakeholders to coordinate feeding efforts throughout the county. And as Tim had mentioned earlier, assisting with operational plans for both alternative care sites and, if needed, for alternative shelter operations if we find that those are needed in the future. And that concludes my report for both social services and homeless services. If there are any questions, we can answer those right now.
Any questions of Mr. Harness? Any questions of Mr. Harness? Thank you very much, Mr. Harness. Appreciate it very much. Ms. Wise.
Thank you, Mr. Chairman. I'm Bonnie Wise, Deputy County Administrator and Chief Financial Administrator for the county. And some of the items have been mentioned already, so I will keep my report brief and you have it before you as your backup. And we're recognizing, of course, the significant disruption to the county's businesses and to employment in our area, especially in the tourism and hospitality area. And we want to be a resource to assist the public. And so with that, we have been partnering with our local, state, and federal partners and our private sector partners to be a resource for those needing assistance. One of our main partners, as previously mentioned, is Career Source Tampa Bay. And we have worked with them to create a flyer and information sheet in both English and Spanish for people who are looking for employment, job search, family assistance. And we partnered with the Hillsborough County Hotel Motel Association to get that information out to the partners and Visit Tampa Bay for any hospitality worker that may be displaced and need information and help either in finding additional new employment or filing for benefits or any family assistance that they may need. In the industry, there have been many openings that have come up, for example, in the grocery stores or Amazon or the Walmarts or the deliveries. And so we're partnering with Career Source Tampa Bay and these businesses who need employees and trying to get people reemployed. And that's worked out well. We know that there has been an overwhelming amount of demand for unemployment assistance, and so additional resources have been put at the state level as well as the local level to help people file for those unemployment services. As I mentioned, there has been a flyer in both English and Spanish. We have links on the county's website for anyone who needs assistance. There are 3 main programs that we're working with in our small business area: State Small Business Emergency Bridge Loan Program, a U.S. Economic Injury Disaster Loan Program, and a U.S. Paycheck Protection Program. And our staff has helped we've had over 500 inquiries and have assisted businesses in preparing their packages for the various loan programs. Our staff is meeting with clients both by phone and by video, and that has been working well. And we are constantly trying to push out the message to our partners in the community so people can get the assistance that they need. As Carl mentioned, we are augmenting our program that we have at the county level already for rental and mortgage payment assistance and for utility assistance. And so the county is going to supplement that with some additional funds and expand the eligibility requirements so that we can help more families who are in crisis during this time. I do have Lindsay Kimball and Ron Barton on the phone with us as well if anybody has any questions regarding any of these programs.
Any questions? Any questions? Anything else, Ms. Wise?
Thank you, sir.
Okay, thank you. Ramin.
Yes, sir. Good afternoon. Mr. Chairman, I submitted a brief for everyone's review, and we'll be happy to answer questions offline if there are any. But in the interest of time at the moment, let me just summarize, if I may, by just highlighting the two issues that COVID-19 has, and in my opinion, will generate as this pandemic continues. The first issue, Mr. Chairman and members, is that although the number of children sheltered for safety, and sheltered for safety essentially means those are children who have entered the foster care system in the last 4 or 5 months and has declined, and that's largely thanks to a prevention strategy that we have instituted. Unfortunately, the social determinants resulting from COVID-19 will likely result in an increased number of children who will enter care. By that, I mean that we know through empirical data, Mr. Chairman and members, and years of analysis, that stress plays a major role in how some people behave. And unfortunately, it's proven that it leads to self-medication, and sometimes that turns into domestic violence, abuse, and neglect. So we're very worried about, as this pandemic continues, how these social determinants, including stress, will play a role in the household and how that will affect the abuse and neglect. We're also concerned that because there are less eyes out there on potential abuse and neglect due to sheltering in place and other social distancing practices because of the pandemic, that lowering of, or that lessening of attention to abuse and neglect as we typically have in schools and other places, that might, and it seems like it already has, led to a decline in the number of calls to the state abuse and neglect hotline. As the number of calls to the hotline decrease, because there are now less people reporting, there will obviously be less investigations. So those could potentially yield to abuse and neglect that goes unidentified. The other issue, Mr. Chairman and members, is the fact that quarantine and self-isolation for symptomatic and exposed foster children who are waiting placement. There are many foster kids who are now in wait lines waiting to be placed. And as they are exposed and as we believe they need to be tested, that is very difficult for us to place them in isolation, because obviously they need to be watched over and cared for. And it's very difficult for us to then expose staff. And our number one challenge at the moment in the child welfare arena is how do we, as we fight this pandemic, is how do we ensure children in our care and frontline employees who care for them are both kept safe. That's a challenge as this thing continues that will unfortunately be a problem. We're working very closely with DCF and with Eckerd Connect, which is the state's lead agency in this county, and we have provisioned one of our cottages at the Lake Mac campus for quarantine. We've had one case where a child, it was thought that the child was exposed. The child went through the testing, and while awaiting test results, actually resided at the cottage, along with a caseworker, or case manager, I should say, who herself was awaiting test results.
So that is something that we'll be working very closely with DCF. We are open to guidance, and obviously as that develops, we'll report back. And the final thing, if I may, is as COVID-19 has also changed the way case managers are visiting foster kids. State law mandates that foster children be visited once every 30 days, at least once every 30 days. That visit has to be in person, and it is quite actually detailed in terms of making sure the child is cared for, that the school records are intact, and so on and so forth. Because of this issue, caseworkers are making their visits virtually, and in some cases where the caseworker thinks that the case is a high risk, not in terms of COVID-19 high risk, but in terms of a child welfare high risk, then those visits are done in the yards, and they are maintaining their distance. But it really does not match up to doing an on-site, eyes on the environment, all detailed visits that they need to do. Those are the three areas that I wanted to highlight, and I'd be happy to answer any questions now or later on offline.
Yeah, thank you, sir. Any questions? Any questions? Yeah, thank you.
Commissioner Miller, I'm sorry to interrupt you, but this is Commissioner Oberman, and this relates to my earlier question, and maybe Mr. Ramin can help us with this. As I mentioned earlier, I'm concerned about the single moms and dads who may not have a support network to find themselves in this surveillance, wait for testing arrangement, and they're not necessarily in the DCF system, but they go to the hospital, and now we have a child that is in need of supervision or care. Between the EOC teams and case management or social services department and then DCF, are you working on solutions for these kids? Because if they have been exposed, they'll need to actually have a quarantine period. And I know we have limited housing. We're going to be working with like Metropolitan. What organizations are going into place for families that have a child without supervision capacity?
Mr. Chairman?
Yes, go ahead.
Commissioner Oberman, that's actually a very good question. Unfortunately, in cases where families are not working with DCF and DCF is not in their lives, then obviously the government, as it were, will have very little or any interaction with that child. But we could provide guidance in terms of family finders. One of the things that we're very excited about is this idea of family finders, where we are scanning all 50 states for family members who are willing and able to take in kids that have been brought into foster care, which would be in lieu of a foster home, and they could then take in the child while they're going through the court process. So we could certainly offer that up as well. But to your point, I think working with the social services and organizations like that would be by far better than DCF.
Any other questions? Any other questions? Thank you, sir. Appreciate it.
Thank you.
Lopez.
Good afternoon. This is Liana Lopez, and I serve as the Chief Communications Administrator for Hillsborough County. Thank you, members of the EPG, for allowing me to speak today about our extensive communications surrounding the Safer at Home order. Early Thursday morning, before the EPG met to consider implementing the order, our communications team was already prepared with a comprehensive public relations and digital media campaign to order passed. Because of our early preparation, following the vote, we were able to quickly post ready-to-go materials on our website, HTV, and social media channels that clearly emphasize the message of the order: stay home, it saves lives. This provided the public and the media with a fact-based resource ahead of the order going into effect, helping to easily refute rumors and calm nerves. On the web, the Safer at Home landing page is accompanied by FAQs that answer common questions in simple terms for both the general public as well as small businesses. Our graphics team has produced printable branded fact sheet versions as well for easy distribution, along with shareable social media graphics that emphasize the basics of the order. All of the information is provided in both English and Spanish and was made available to all partners in the JIC, the Joint Information Center. The Safer at Home pages complement a rapidly growing library of valuable, factually accurate content that the county has developed alongside the Florida Department of Health and many of our partners in the Joint Information Center since we launched that center in early March. The Stay Safe page is a home page for all of our COVID-19 related information. This includes the Safer at Home page, the latest from the Centers for Disease Control and the Florida Department of Health, and 2 separate hub pages, one specific for businesses and one for residents. The content explains how people can take action, how they can get help, and how they can provide help if they are able. We know that our residents and businesses are looking to us for accurate information. Since the order passed, our site has had more than 640,000 visits and more than 1.2 million page views. The top 2 pages were Safer at Home and Stay Safe. Overall, website traffic was up about 700%. These numbers play out on our social media channels as well. So far this month, we have added over 8,800 new followers to our social platforms. Our team has sent 275 messages via Facebook, Twitter, Instagram, Nextdoor, and LinkedIn. HTV has posted 40 videos that have earned upwards of 58,000 views on our YouTube channel alone. We're also seeing resonance in the media. Our earned placements since the Safer at Home order was issued are up more than 400%, with positive sentiment at 94% since Thursday. The local media have been outstanding partners throughout this event, working alongside the Joint Information Center on so many important stories, including the Safer at Home order, the drive-through testing site, and the Pet Resource Center's Creative Cuddle Shuttle program to clear the shelter, among many others. The Joint Information Center has issued 33 media releases so far, all also issued in Spanish to be sure these crucial messages reach our Spanish-speaking community. In addition to earned media placements, we are doing English and Spanish media buys where appropriate. These include billboards, print, and online ads, TV, and radio. Overall, we have worked to maintain an open line of communication and a collaborative resource library with all the members of our Joint Information Center. Our goal is to continue to be the reliable source for Hillsborough County residents by sharing facts and providing support to our community. Additionally, as Administrator Merrill mentioned, we will be working with the Hillsborough County Emergency Management to ensure the rollout of the quarantine and isolation facilities to the media and to the public at a later date in a coordinated, methodical way, recognizing there's a need to balance public expectations, ensure the HIPAA and privacy rights of any guests that may need to use the facility, and also wanting to be transparent to the public we serve. At this time, we anticipate either a media walkthrough prior to the site's opening, or HTV will take B-roll and we will provide that to the media. Those are our preliminary thoughts, recognizing that once any guests arrive, the facilities will be completely closed to the media and access will not be granted. Once we are ready, we'll provide needed information to the public. Finally, I just want to remind everybody, for the latest information on COVID-19 and how you can help in Hillsborough County, visit hcfl.gov.net/staysafe. At this time, thank you, and I'm open for any questions.
Any questions, Ms. Lopez? Any questions, Ms. Lopez? Thank you very much. Mr. Merrill?
We have nothing else at this point. There are no questions. I do, though, want to again thank the owners of the hotel for really working very quickly, very collaboratively with us, and thank our real estate staff and county attorney's office, Lucia Garces folks, for really putting this together quickly and efficiently. And this is going to be a huge relief for our hospitals and other facilities who need to make room for other patients and keep those who are unfortunately infected with COVID-19 separate so they can or be tested appropriately. So with that, we're finished.
Well, thank you, and thank you to all of those staff members that gave the summer reports. We appreciate it very, very, very much. Is there any other discussion that we need to do here as an emergency policy group? Any other discussion? Mr. Chair?
Mr. Chair, it's Commissioner Merrill. Oh, go ahead.
I heard someone before you, Mr. Commissioner Merrill. Who was that?
This is Andy Ross, Mr. Chair.
That's right, Vice Mayor Ross.
Thank you. I'd like to propose a very minor modification to our order of last week, and it has to do with what we're talking about, hotels and motels. Paragraph 9 of our existing order provides preferential lodging for certain groups of people, and it defines what those essential lodgers are. I would move that we add to the list of essential lodgers truck drivers.
That's the motion by Vice Mayor Ross. Is there a second?
I would second that. Commissioner Murman.
Vice Mayor Ross, you want to go into a little bit more detail?
Well, it's self-explanatory. As I read it, if you interpret it the way I interpret it, they kind of fit in there already. But my concern is that not every desk clerk at the hotel is going to necessarily interpret it that way. We do have, now in my city, we only have a few hotels, but we're countywide, we have several. And I know that one of our businesses in particular contacted me and had some concern over this because he often gets trucks that arrive from out of state in the middle of the night who finish out the night at a hotel. So that's the reason for the motion.
Okay, is there any other discussion on the motion by Vice Mayor Ross?
This is Commissioner Overman. I'd like to comment to that point. Thank you. There is the truck drivers as well as another important essential service that we provide, which is our agricultural community. Many of the workers that are in that industry delivering the foods to our markets cohabitate in tight quarters. Currently, it doesn't appear to be a problem, but I would not want them to think that they don't, or their employers don't have an option to consider the hotels as a place to help provide safe quarters for individuals to avoid cross-contamination. I don't know if it's needed, but I think if we're going to make the option or make it more clear that truckers are available, I'd like to suggest that we consider our agriculture workers as well.
Okay, so what do you want to do?
Can I offer an amendment to the motion?
Can.
Then I recommend that the emergency policy group consider amending our order to include those essential workers, which include truckers as well as any agricultural workers that need essential lodging.
Is there a second to the amendment? Is there a second to the amendment?
Vice Mayor Ross.
I'll second the amendment.
Who's that?
School board member Snively. I'll second that amendment.
We have a motion. We have an amendment to the motion by Commissioner Oldman, second by School Board Member Snively. Is there any discussion on the amendment? Any discussion on the amendment? Call the roll on the amendment.
Miller?
Yes.
Overman?
Yes.
Murman?
Yes.
Cronister? Yes. Astor?
Yes.
Ross? Yes. Lott? Yes. Highway?
Yes.
Okay. Amendment carries 8-0. The amendment is adopted. We're now back on the main motion that was amended by Vice Mayor Ross and seconded by Commissioner Murman. As there is any further discussion on the amendment? I'm sorry, any discussion on the motion? Any further discussion on the amended motion? Any further discussion on the amended motion? Hearing none, please call the roll. Miller? Yes. Overman?
Yes.
Murman?
Yes.
Officer? Yes. Pastor?
Yes.
Ross? Yes. Lott? Yes. Snively?
Yes.
Motion carried 8-0. Motion is adopted. Commissioner Murman, you recognize.
Thank you, Mr. Chair. And I just want to give y'all some brief statistics because Career Source, we brought that name up a lot today. And yes, our staff is working very hard with them. And I really appreciate all the efforts. But they are almost becoming a secondary emergency operations center. Last week alone, over 73,000 unemployment claims were filed statewide. Here in Tampa and Hillsborough County, we went from 1,200 this time last year and went to 7,548. And so you can see that there are a lot of people out there that are going to need assistance. So I'm just very happy that Mr. Merrill and his team have a solid plan in place. And I think we are now prepared for what is ahead of us, including Career Source.
Yeah, thank you. Any other discussions we want to have this one time? Any other business?
Chair Miller. Mr. Miller would like to offer an item for the next meeting.
I think I heard somebody else first. Was that Ms. Snively?
Yes, sir, Mr. Miller. Chair Miller. Just may I speak? Thank you so much.
Sure.
I just wanted to offer just a little bit of information based on the conversation we had a little bit earlier about children and identifying children. I know we were specifically talking about foster children, but then the conversation, which I appreciate Commissioner Oberman just bringing that up about making sure that our children are taken care of, especially if they come from homes that don't have the support system in place if one of their parents or guardians are ill. And I just wanted to reiterate that the school district continues to provide meals on a daily basis to our students. We've expanded our sites to almost 150 locations where we are able to either deliver food or parents or guardians can pick up meals for the children. But we're also using that as an opportunity to make sure that our eyes and ears are open to anything that we might see where a child or children could possibly be neglected or in need of any other type of support or assistance that we could alert the appropriate people for supporting those students, those children. So I just wanted to let everyone know that the school district is doing its part to make sure that we're keeping an eye on our students as much as we can, even though we're on the e-learning path, but we're still making sure that some of our most marginalized students, we're keeping an eye on those students as well to make sure that they are in proper care and that they are not being neglected and hopefully not experiencing trauma. We do have mental health services and hotlines set up for our families who need that. So I just wanted to offer that for the group so that you know that we are a lot of eyes and ears and boots on the ground, keeping an eye on our children out there. Thank you.
Mr. Dudley, thank you very much. That's very important that you gave us that information, and thank you for all the work that you and the new superintendent, he came on board in the middle of a pandemic, and I know he's got his hands full too, so thank you very much.
He sure did. He had to hit the ground running. Thank you so much.
He did. Commissioner Overman, you recognize.
Thank you, Chair. I'd like to ask for a report at the next meeting if possible. HEART is a vital service and part of our emergency response team to some degree. And many of our essential workers, as well as county employees, rely on public transportation in order to be able to get where they need to go. They've indicated that they're going to be reducing some services and routes in an announcement today, and I'd like to ask that they come to us, since we don't have a board meeting scheduled this month, until later on in the month. I'd like to bring to the EPG a report from heart to help us understand what it is they need and how they're actually servicing as an emergency response our citizens at this time.
Commissioner Overman, that information has been sent out a number of times by HART concerning the reducing services and the reduction of number of people riding the buses. It's way down. I think it's almost like 40% reduction in ridership. That I got that information from Ms. Carolyn House Stewart. Do you want her to come in and give her a report of something that's already out, or what do you want to do?
I think my question, thank you. I think my question relates more to the routes that are servicing our essential services and those that are the hours that are run. A Sunday service may not necessarily provide transportation option for some of our essential services, and that route and timing may matter to the delivery of food, grocery stores, and other childcare, things like that. So I was just curious if they could come to us and help us understand that the analysis they've done on cutting back services coincides with the ridership that we're experiencing, even with a 40% decline.
Well, it coincides with ridership to the services. Let me say this, that they have been meeting with staff, has been meeting with the union and working every possible detail out to make sure that services that they're putting in place meet the needs of those essential ridership that the people need on those particular buses. The routes that they're reducing it to are the routes that are meeting the needs of people that need to get where they need to go, either to work or the essential workers, or they can't stay at home remotely. Now, we can bring Ms. House Stewart and anyone else on here that you want to bring on next Thursday, at the meeting on Thursday, but I can tell you right now in discussions with her, and if you read the information that came out, they're meeting the needs of every possible person that needs to ride that bus, even though our ridership is down, to meet the needs of those people who need to get where they're going. So if you want to bring her or bring Ms. House Stewart here or anyone else to break that discussion on Thursday, we can, but I would suggest before we do that, if you have any questions of her, give her a call. She'd be more than happy to answer any questions you may have, and what they've been doing and meeting the needs of the people and working with the union to make sure that those drivers are doing what they need to do, and we'll protect them as much as we possibly can.
Thank you very much for that information. I appreciate it. No, I think that was sufficient, and I'll reach out to her. Thank you.
Okay. Any other business we want to discuss today?
Mr. Chair, it's Commissioner Murman. I just wanted to ask, did the school board extend they were going to be closed till April 13th. Have they extended it? I guess this question would be for Ms. Snively. I'm getting a lot of questions from constituents.
Snively?
Thank you, Chair. There's not been an official announcement that I'm aware of from the superintendent yet. The board does meet tomorrow. I anticipate by tomorrow we would have an answer as to whether or not we are returning to school. I will speculate based on some of the information and say that I think people are planning to not return to school this school year. However, that will be determined probably in the next 24 hours by our superintendent and board.
Wow. Okay. Thank you, Mr. Chair. You've done a great job. Appreciate all you've done.
Thank you. Thank you for all of you on this call for what you've done. Anything else we need to discuss today? Anything else? We have another scheduled EPG meeting that's coming Thursday at 1:30. Information will be set out by Mr. Merrill and his staff concerning that meeting. If you need to get with Mr. Merrill on anything that you want him to talk about, please get with him to do that. And if there's nothing else we need to discuss today, we are adjourned.
Thank you.